to our third episode of Serve Lights.
What's up? We are back with another one, and we will be talking about childhood trauma. We also have our special guest,
Bryon Bellamy.
Oh, shoot.
Hey, we gotta do it.
Rocket.
All right, Cerissa, so I know that you work with at-risk youth, and I know that you're currently getting your master's in social work, so why don't you elaborate on that?
Yes, so I am getting my master's in social work. It's an accelerated program. So I previously went to A&T, Aggie Pride, and I got my bachelor's, and I got my bachelor's in social work. And so I do have experience working with at-risk youth, as you mentioned, in a residential treatment facility. I've also been a transitional living specialist, working with youth who are in foster care and aging out of foster care, just helping them transition into an apartment or getting their driver's license, just working on those life skills and soft skills. And I've also done clinical assessments to assess for mental illnesses like anxiety, depression. So I've played a couple different roles. I've worn like many hats, and I've enjoyed every part of it.
Yeah. And Bryon, I know you teach self-care classes.
Well, yes. And I work in the field of peer support with people with mental health and substance abuse disorders. Many of these people have experienced trauma. Self-care, man, I'm a big believer in self-care. I think self-care is the foundation of, mental health, and so I take it real serious and how intentional it is.
Yeah. So let's backtrack. So what exactly is trauma to y'all?
So trauma is an event or a series of events that affects your emotional well-being, that causes like negative emotions and your ability to cope, and that can come in many different forms as far as trauma. It can be physical, sexual, emotional abuse. It could be neglect. It could be witnessing your parents abuse alcohol. It looks different in many situations, so it's just being able to identify like what is the root of that trauma, and those are some examples of the types of trauma that can occur.
Yeah.
Exactly. Going on with that, a lot of times we don't know that we have experienced trauma.
That's true. That's very true.
And a lot of the trauma that we don't know we experience, maybe poverty. Poverty is very traumatic.
That's a good one.
Yeah.
Also, when we're talking about oppression, whether it be external or internal oppression. Internal oppression happens when somebody's been oppressed so long that they begin to oppress themselves or their subgroup, so yeah.
That's powerful.
Yeah, it is. And then childhood trauma, why is that significant?
That affects your cognitive abilities, and it can cause developmental delays. It can also affect you long term with your physical health. It really weighs on your body, it weighs on your mind.
Yes.
So if it's not addressed, it's long-term negative effects for sure.
Definitely.
Yeah.
So when you're working with your clients and the students that you are taking care of, what are some tactics that you've used to help them through these traumas and these childhood traumas?
Bryon, you want to start?
Yeah. Man, there's so many.
Yeah.
Meditation is big. If they're into church, spiritual life is big. Man, if we're talking about trauma that deals with poverty, we go over budgeting. You gotta hit the trauma at the root.
Yeah.
So every skill is specific to the trauma. You don't want to treat something or use an intervention or coping skill that doesn't apply to what they're dealing with.
I like that you said that. So it's basically assessing that client or that individual, seeing where they are, and then finding a intervention or a step or action plan that matches that trauma.
Exactly.
Yeah, that's perfect. I like that.
Like in your self-care class, could you give an example of how you help one of your students through their traumas?
And tell us more about your self-care class too.
Yeah,
It's interesting. Yeah.
So it's very important when somebody's in recovery, right, that they're in charge of their own recovery. You know, because the only way that you're gonna recover from trauma is that it's the recovery of your choice, basically.
Like you take ownership.
Take ownership. And I can't design your own recovery. I can only advocate and support you in your recovery.
Yeah.
And so, man, like I give my story because I believe in being very transparent and letting people know that you are no different than they are.
Yeah.
You're a peer just like them. And once people know that you're relatable, and so I speak to them at a level where they are. I come to them where they are. So if we're talking about, let's go back to budgeting, you know, because that's a big thing in our community right now. Poverty is really big right now.
Homelessness too.
Yeah. Homelessness.
A lot of the kids I work with
It's
not knowing how to find housing, adequate housing at that.
and there's no housing in Durham.
Yeah, so it's like the issue just
It
And
compounded.
gentrification is happening, and we're like being pushed out.
Yeah.
So how do you? So sometimes you gotta prepare somebody for homelessness.
Yeah, that's real. Yeah, let's be realistic about
Yeah.
what's about to happen when you leave foster care.
Yeah.
Your parents aren't going to take you back in because it's too much trauma there in the home.
Yeah.
There's no more room at the shelter, so you can't go there. So a
And
lot
you
of the
work
youth
with,
that
like,
so a lot of the youth that I've worked with that have aged out of foster care, literally they have nowhere to go. So we're having like brainstorm. Okay, is there independent living where it's supervised? Can you go there? But then they have limited spacing there. So we're having to scramble before they actually exit the system. We got like 30, 40 days to get them a place to stay. And it's very difficult to do that. So,
It's really tough, man. Like it's easy to tell somebody that you're going to help them meet their goals, but you don't tell them that they're going to meet their goals.
Yeah.
You know, you help them in the process of meeting their goals, and what you want them to be is further along than they were before.
Yeah, that's true. That's
You know.
true. And then too, you want to equip them with the tools that they need versus telling them. I think the important thing is to show them, teach them,
Yes.
because that's a lot of what's going on with the kids who are in the foster care system.
Yeah.
Granted, I think it's an okay system, but I think a lot of them leave not understanding how to communicate with authority figures. They're not understanding how credit is important when you do search for housing. It's a lot of skills that are missing, a lot of tools that is missing from their toolbox. I know the teachers have a lot going on and they're there to teach, but if you see a student that is in a classroom misbehaving, they may be disruptive, my thing is take the time to ask them, well, what's going on, little Johnny? Like, don't be so quick to diagnose them, oh, they got ADHD, or
Don't be
call
so
the
quick to
principal,
assume.
come get them. Actually take the time and figure out, just ask the right questions. Like, hey, like, how was last night? Like, did you eat? Like, did you sleep? Because a lot of the times, that's what it is. They get in class and they can't focus because they hungry.
Go along with that, being person-centered.
Yeah.
You know, and so you don't treat somebody as their trauma.
Yeah.
The trauma is just
That's
their
really
experience.
good. Yeah.
You know, so let's just talk about somebody that is dealing with alcohol abuse. They're not an alcoholic.
Yeah.
You know, there's somebody that has a substance abuse disorder.
Yeah.
You know,
This is really good.
go along. I don't call people crackhead. You know, somebody who's dealing with a cocaine addiction. You know, somebody who is experiencing cocaine addiction. You know, and so even with a traumatic, you know, somebody is not. You're not just a poor person. That is not your identity.
Yeah.
You know, you're somebody who is having financial issues.
I like that wording.
You know.
Yeah. I like how the verbiage there.
Yeah, and so and person-centered is really big when we're even talking about self-care. You know, and like I was telling you all earlier, like self-care is not selfish.
Right.
And so when talking about dealing with trauma, if you cannot first start to take care of yourself, you're not going to be able to go through and do the measures of trauma.
Yeah.
Going to therapy,
Yeah.
finding out how you feel when you're actually well.
Yeah.
What does that actually mean to be well?
That's powerful because so many people get so used to suffering
Yeah.
It almost becomes an addiction.
Yeah.
Mm-hmm.
They don't
It's
even
like
know
you're
that.
addicted to it.
Yeah. They don't even know that they're actually going through trauma.
Yeah.
Well, some people feel comfortable in chaos.
Yeah.
That's what I would, and
Mhm.
that suffering is a real thing. You sit in it, you live in it, that's all you know.
Once you find that, once you begin to learn how to take care of yourself, then you're gonna be like, oh my God, I didn't understand that I was in chaos.
Yeah.
You know, because now I don't feel comfortable in chaos.
Yeah.
Mhm.
Yeah.
I don't feel comfortable in trauma. You know, so that self-care is a major piece in helping somebody work out their trauma.
Mhm.
And healing too. Let's get
Yeah.
to that
Yes,
healing
yeah.
place.
The trauma from social media. You mentioned that
Yeah, you
earlier.
did mention that earlier.
Yeah, I mean, social media can be very toxic,
Ooh, very.
and you can get lost in somebody else's made-up life,
Mhm.
and you're judging your life based off of their fake life.
Yeah. I heard that
That causes depression too, because you're
Depression.
comparing yourselves to that individual who in real life is probably in
Depressed.
poverty
Yeah.
too.
Yeah, depressed.
Depression rates are actually going up.
You know,
Based
and
off
actually
social media.
experiencing trauma. Yeah. So that comparison thing is real.
Oh yeah.
Yeah.
Yeah. And I think that, like, even my social media is very, like, familiar oriented. And so people are like, well, you got the same people in your social media for, like, the last 4 or 5 years. I'm like, yeah, well, it's my tribe. So, you know what I'm saying?
Sorry.
I ain't got nothing to
Sorry.
prove.
Yeah.
I'm not trying to show off for y'all or nothing like that.
But I don't post, like, my possessions or anything in social
Yeah.
media
Yes.
like that.
It's a thing now where social media is the cause of the depression and the anxiety. So
Yeah.
And even the access that we have in seeing death through YouTube or, you know,
That causes serious trauma.
and see racism, you know,
yeah.
I mean, that's the big thing happening right now, you know, just like we're seeing
yes, Black Lives
Black Lives Matter, man. We're seeing black men get killed or black women get killed, you know. And so we just have so much access to death.
Yeah.
And what that's doing is chipping away at our foundation.
Trauma can have some long-term effects, and it can pop up on you in your adulthood. And so when it does pop up, actually acknowledge it, figure out why you're experiencing these behaviors or these emotions, and start to do some evaluation. Take a look at the people around you, take a look at your job, are you happy? And take a look at, okay, what trigger is causing this negative behavior? And then once you do that, maybe seek some counseling, some therapy.
We just want to thank Bryon for being on our
Yes.
show.
You're awesome.
And real quick, so he's starting a really cool movement called the Act Right Movement.
Hey.
So real quick, just tell them what it is, what it's about, your vision for it.
So Act Right Movement is about changing our community and how we relate to each other. Men relating to women, you know, so there's two parts of the Act Right Movement. Men come correct, you know, so men come correct to men come correct to women in the community. Because how can we treat, how can we be kings and we don't know how to treat queens?
Snaps for that.
You know?
Yeah.
And then the other part, you know, which, you know, is the act right part where women act right towards each other,
Right.
towards men, you
Right.
know. And it's two charged phrases so that they incite change.
I support. I'm
Good
ready.
stuff. Let's come correct and act right
Hey,
together.
hey. All right, well, signing out. Oh, make sure you follow us, subscribe, share this. Click the link in the bio right there.
Bang, bang.